Early signs of kidney disease, healthy wisdom. Imagine this. You wake up feeling unusually tired. Your ankles are swollen, and suddenly you notice a strange foamy texture in your urine. Would you brush it off as nothing, or could it be your body's silent warning sign? What if these small changes were your kidneys crying out for help, long before the real damage sets in? Today, we'll explore the early signs of kidney disease clues that are often missed until it is too late. Knowing them could protect your health, or even save your life. Why kidney disease matters. Kidney disease, also called chronic kidney disease, CKD, is one of the world's most silent health threats. According to the World Health Organization, millions of people live with kidney problems without even realizing it. Why? Because kidney disease often develops quietly with symptoms that seem minor or unrelated. By the time most people notice something is wrong, their kidneys may already be severely damaged. Your kidneys are two small bean-shaped organs, but they perform life-sustaining tasks every minute of the day. They filter waste, balance electrolytes, regulate blood pressure, produce hormones for red blood cells, and keep your body's fluids stable. When kidneys fail, toxins and excess fluid build up in your blood, leading to serious complications, sometimes even the need for dialysis or a transplant. The good news? If you catch kidney problems early, you can slow or even prevent serious damage. That's why recognizing the first warning signs is so important. Causes and mechanisms of kidney disease. So what causes kidney disease? Let's break it down simply. Diabetes. High blood sugar slowly damages the tiny blood vessels in your kidneys, making them less able to filter waste. This is the leading cause of kidney failure worldwide. High blood pressure. Hypertension. When your blood pressure stays high, it strains the delicate kidney filters, leading to scarring and reduced function. Infections and autoimmune conditions. Diseases like lupus or frequent kidney infections can trigger inflammation, weakening the kidneys over time. Lifestyle factors. Excessive use of painkillers, like NSAIDs, dehydration, high salt intake, smoking, and obesity all raise your risk. Genetics and aging. Some people are simply more predisposed, and kidney function naturally declines as we get older. Think of your kidneys like coffee filters. If you overload them with sugar, pressure, or toxins, they start clogging and tearing. At first, you might not notice a difference in your cup of coffee, but eventually, the filter breaks down and everything pours out unchecked. That's how kidney disease progresses slowly, silently, but dangerously. Symptoms and early warning signs. Here's where things get tricky. Kidney disease often shows subtle early signs that people mistake for normal fatigue or aging. Let's look at the key ones you should never ignore. Unexplained fatigue and weakness. Healthy kidneys produce a hormone called erythropoietin that helps make red blood cells. Damaged kidneys mean fewer red blood cells, leading to anemia. Result? You feel tired, weak, and drained of energy, even after a full night's sleep. Changes in urination. Foamy or bubbly urine, a sign of protein leaking into your urine. Blood in urine may appear pink, red, or cola-colored. More frequent urination, especially at night. Less urine output despite drinking fluids. Swelling, edema. Kidneys regulate fluid balance. When they struggle, excess fluid builds up in your body, especially in the feet, ankles, and around the eyes. Persistent puffiness around the eyes. This often happens due to protein leakage, a hallmark of early kidney trouble. Back or flank pain. Not every kidney problem causes pain, but if you feel a dull ache in your back, especially below the ribs, it could be a sign of infection, stones, or kidney inflammation. Metallic taste in the mouth or bad breath. Waste buildup in the blood, uremia, can cause a metallic taste, loss of appetite, or ammonia-like breath odor. Itchy, dry skin. When kidneys fail to balance minerals and remove waste, it can irritate your skin. Nausea and loss of appetite. Early kidney disease can reduce appetite and cause weight loss without explanation. Individually, these may not seem alarming, but when combined, they form a pattern. Your kidneys may be in distress. Dangers and complications. So why is kidney disease so dangerous? The answer lies in the complications that follow. Cardiovascular problems. Kidneys and the heart are deeply connected. Poor kidney function raises blood pressure, damages arteries, and significantly increases your risk of heart attack and stroke. Bone and mineral disorders. Kidneys control calcium and phosphate balance. When this fails, bones weaken, leading to fractures and osteoporosis. Fluid overload. This can trigger dangerous swelling in the lungs, pulmonary edema, making it hard to breathe. Severe anemia. Without enough red blood cells, oxygen supply to tissues plummets, leaving you constantly exhausted. Dialysis or kidney failure. The final stage is end-stage renal disease, ESRD. At this point, dialysis or a transplant is required for survival. What makes it even more alarming is that kidney disease progresses slowly but relentlessly. Many patients discover it only when more than 70% of kidney function is already gone. Prevention and practical solutions. The good news is that many kidney problems can be prevented or managed early. Here's how you can protect your kidneys. Manage blood sugar and blood pressure. If you have diabetes or hypertension, regular checkups and proper medication are essential. Keeping these under control is the single best way to protect your kidneys. Stay hydrated. Water helps flush out toxins. Aim for 6 to 8 glasses daily, unless your doctor recommends otherwise. Limit salt and processed foods. Excess sodium raises blood pressure and stresses your kidneys. Choose fresh foods and cook at home when possible. Use painkillers wisely. Long-term or high-dose use of NSAIDs like ibuprofen can harm the kidneys. Use only when necessary and under medical guidance. Quit smoking and limit alcohol. Smoking damages blood vessels, including those in the kidneys. Alcohol in excess can worsen high blood pressure and dehydration. Maintain a healthy weight. Obesity is a strong risk factor for diabetes and hypertension, which in turn damage the kidneys. Regular checkups. Simple blood tests, like creatinine and GFR, and urine tests, checking for protein or blood, can detect kidney issues early even before symptoms appear. Analysis and perspective. Clearing misconceptions. There are many myths about kidney disease. Let's clear up a few common ones. Myth 1. If I don't feel pain, my kidneys are fine. Wrong. Most kidney disease is painless until advanced stages. That's why it's called a silent killer. Myth 2. Drinking lots of water can cure kidney problems. While hydration is important, water alone cannot reverse kidney damage. Medical care is essential. Myth 3. Only older people get kidney disease. False. While risk increases with age, diabetes, high blood pressure, obesity, and genetic conditions mean younger adults can also be affected. Myth 4. Kidney disease always leads to dialysis. Not necessarily. With early detection and lifestyle changes, many people manage kidney disease without ever needing dialysis. Think of kidney care like maintaining a car engine. You don't wait until the engine breaks down to change the oil. You perform regular checkups to prevent disaster. Your kidneys deserve the same care. Kidney disease is a silent but deadly condition. The early signs like fatigue, changes in urination, swelling, and loss of appetite might seem harmless, but together, they can reveal a serious underlying problem. Left unchecked, kidney disease can damage your heart, bones, and overall health, sometimes leading to life-threatening complications, but you are not powerless. By understanding the causes, recognizing the signs, and taking preventive steps like controlling blood pressure, eating wisely, staying active, and checking in with your doctor, you can protect your kidneys and live a longer, healthier life. So listen to your body. Don't ignore the subtle clues. It could mean the difference between early treatment and late regret. If you found this video helpful, don't forget to like, share, and subscribe to Healthy Wisdom for more simple and reliable health knowledge every week.